And here at Queen's Park, rising COVID cases dominated discussion the day after the science table revealed Ontario is seeing the highest COVID rate yet, with about 100,000 new cases a day.
Why is the Premier simply waiting for hospital beds to overflow?
We need to learn to live with COVID. Sadly, it's not going away. In fact, the increase in cases that we're seeing now is expected.
Yes, the Chief Medical Officer of Health did say cases were expected to rise when he announced lifting mask mandates 4 weeks ago. But he never said they would rise to 100,000 daily cases. On Monday, the Premier also said an increase in cases was anticipated.
We expected a little spike.
He never mentioned this spike is actually the largest of the entire pandemic. It's too soon to know what impact this wave will have on hospitals. Dr. Peter Uni from the Science Table believes it will be less severe than past waves because of high vaccination rates, and up to 5 million people have already been infected with Omicron, so we'll have some natural immunity. In past waves, hospitalizations didn't spike until a couple of weeks after the peak. No one can say when that peak will be.
The advice that we're getting, literally from every medical officer of health, from the science table, is get these masks on. That's the quickest, easiest way for us to slow this tidal wave down.
Today, both the NDP and the Liberals called for masking to return to essential indoor spaces like pharmacies, grocery stores, and schools.
This wave is going to go up, and just like every other wave, it's going to come down. The key thing here is, can we lessen the burden of this wave?
Infectious diseases specialist Dr. Isaac Bogosh also believes mask mandates should be reintroduced.
We can all acknowledge that it's not perfect, but it still helps, and it helps enough that if we're all wearing masks, we're certainly protecting the individual wearing masks. We can probably take the edge off a wave, and we can certainly protect other vulnerable individuals.
The Ford government maintains masking is voluntary and a choice. They've made no indication they will consider making them mandatory again. Masks are still mandatory in hospitals, long-term care, and on transit, but that last order is scheduled to be lifted on April 27th.